So today I'm going to be meeting with Assembly Member Joaquin Arambula. Assembly Member Joaquin Arambula is a key member of the California State Assembly Committee on Health. He is an ER doctor who is a champion for improving health access and affordability and the critical shortage of healthcare providers.
Hi, good morning and welcome.
Hi, good morning, Assembly Member Arambula. Thank you for meeting with me today. My name is Norman Jakes Quinones. I'm a registered nurse with 15 years of experience in critical care, PACU, and perioperative nursing, and I'm currently completing my graduate training as a clinical nurse specialist. My work centers on patient safety, systems improvement, and equitable access to care.
You're so welcome. It's a pleasure as mine. So you're a nurse. Thank you for all the work you do. It's truly inspiring. What can I help you with?
Yes, thank you, sir, for your kindness. As a key member of the California Assembly Health Committee, you are someone who has consistently championed improving health access and affordability and ensuring the protection of safety net programs for working families. You have also worked to address the critical shortage of doctors and medical providers and in expanding workforce development programs and opportunities. I sought to meet with you today to bring attention to the far-reaching consequences of the One Big Beautiful Bill Act and how it threatens both healthcare access for Californians and the well-being of the frontline nursing workforce.
So what exactly are your concerns about the OBBBA?
Yes, sir. So absolutely, Assembly Member. OBBBA is projected to remove healthcare coverage for over 10 million Americans. When people lose coverage, they delay or avoid care until their condition reaches a crisis point. Nurses are the ones who shoulder that impact. We see preventable suffering every day, and it creates profound moral injury. We're placed in situations where we know what a patient needs, but systemic barriers prevent us from providing it. Over time, that erodes the workforce, accelerates burnout, and compromises patient safety across the state.
Moral injury is a strong term. What does that look like in practice?
In practice, it means a nurse watches a patient deteriorate for something that could have been managed with basic preventive care, but now requires critical intervention. It means discharging someone knowing they can't afford follow-up. It means absorbing emotional distress that stems not from clinical limitations, but from policy-driven gaps in access. It's ethically distressing, and it's pushing many nurses out of the profession.
And how do you see it impacting California specifically?
So California already faces primary care shortages in most counties, rising registered nurse vacancy rates, and increased emergency department overcrowding. If the OBBBA takes coverage away, the burden will fall disproportionately on safety net hospitals and frontline nurses. This isn't only a workforce issue. This is also a patient safety issue, a financial sustainability issue, and ultimately an equity issue.
What solutions are you recommending for the problem?
I believe California can take proactive, cost-effective steps to safeguard access and stabilize the workforce. First, the state needs to establish state-funded, nurse-led public health centers staffed by advanced practice registered nurses and modeled after the Henry Street settlement. These centers would provide preventive care, chronic disease management, maternal child health, mental health support, and health education. They would serve as safety net access points for people displaced by coverage loss and reduce emergency department overuse. Second, the state needs to empower nurses by enacting full practice authority for advanced practice registered nurses. Granting full practice authority to NPs, CNSs, and other APRNs allows us to diagnose, treat, prescribe, and manage patient panels independently. Evidence shows that advanced practice registered nurses expand access to care, reduce costs, and maintain high quality outcomes, especially in underserved communities.
What do you say to the other critics on the other side that believe expanding authority for advanced practice nurses or registered nurses may compromise the safety of patients?
Yes, thank you for that question, sir. Decades of data show that APRNs deliver safe, high quality care with outcomes comparable to physicians. More importantly, in many communities, the alternative to APRN led care is no care at all. I think this demonstrates the urgency and the necessity of optimizing the workforce we already have in our state who have those skills and training to meet the demands and challenges facing our healthcare system. It is important to note that granting full practice authority doesn't replace physicians, it expands the capacity of the entire system. It's a workforce multiplier that improves equity, affordability, and access.
And what are you asking from my office specifically?
So Assemblymember Arambula, I respectfully ask for your leadership in advancing legislation to establish nurse-led public health centers and supporting full practice authority for advanced practice registered nurses such as myself, CNS. These steps will protect access to care, reduce preventable harm, and strengthen the stability of California's healthcare workforce.
Thank you so much for bringing this matter to my attention. Please send up any follow-up materials that you might have. Thank you.
Yes, thank you, Assemblymember Rambula. I appreciate your time and your commitment to advancing equity and patient safety in California. I'd be happy to provide that data, stories from the bedside, or support for the next steps your office takes. Thank you so much.